name is Dr. Amber French, and I have been here in the Dahlonega area for the last 12 years, serving Dawsonville as well, and I have been in Brazelton for 3 years ever since I joined NGPG. Hormone replacement therapy is an attempt to put back whatever hormones that a woman, or I guess a man as well, but in my case women since I'm a gynecologist, would be missing. There are a lot of different approaches, and each doctor takes their own approach because it's going to be based on their experience, their knowledge base, the success their patients have had with it. My approach is a bit different. I typically do salivary testing to see where your levels are, and based on your salivary test, I have a compounding pharmacy make natural bioidentical hormones for my patients. They are made from yam, so they start from a natural plant base, and they're compounded to be identical to the chemical formula that your body would be making naturally. So the type of hormones that I typically use are given topically. I would say 90% of my patients are on them. You rub it onto your arm, upper inner thigh. A few of my patients are on what's called a troche that dissolves under the tongue. Very occasionally I'll have people on a combination of a pill plus a topical or maybe a patch, but my go-to is usually a topical that you rub on the skin once a day. Hormone replacement therapy has a lot of benefits. I mean, there are reasons women feel better prior to menopause than they do afterwards. From an internal anti-aging standpoint, they lower your risk of cardiovascular disease. They protect your bones from osteoporosis. They lower the risk of Alzheimer's and Parkinson's. There's even some studies that say maybe even lowering the risk of colon cancer. There are benefits to hair, skin, nails, and what we kind of just say an overall sense of well-being, aside from the things that most people relate, which would be the hot flashes, the night sweats, the mood swings, insomnia, and that list could be pretty long. Women of any age are appropriate for hormone replacement therapy. It just depends on what's going on. My typical patient is peri or postmenopausal, but I have younger women too, maybe with PCOS, that's polycystic ovarian syndrome, women who are trying to get pregnant. Basically, at any point in your life that your hormones are not working appropriately, you're a candidate for hormone replacement therapy.